Welcome back. We all know there's a whole alphabet of vitamins, minerals, and micronutrients that accommodate a well-rounded and healthy diet. But do you know exactly what each of them do and why our bodies need them? The answers to these questions can get pretty complicated, but today I want to start by taking a look at zinc. Let's start with the basic question. What is zinc? It's actually not a vitamin, but rather a mineral. To be specific, it's referred to as an essential trace mineral. Essential meaning that your body cannot produce it or store it. Trace meaning that its concentration is very low as it functions as a cofactor within our bodies. Cofactor basically means that it's used in the body to help and assist other enzymes to do their thing. So what does it do? Zinc acts as a catalyst to help increase the speed of certain chemical reactions throughout the body, producing hundreds of proteins. In fact, 10% of the proteins in our bodies are bound to zinc, which is why it's an essential mineral. What can cause zinc deficiency? Well, it's estimated that a third of the population is at risk for zinc deficiency, and it's the fifth most important risk factor for disease in developing countries. Glyphosate, which is the most commonly used pesticide in the world and is used in agriculture on a wide variety of crops. This pesticide ends up binding and blocking the activity of zinc within the body and can lead to zinc deficiency. Some other things that can decrease the absorption of zinc include gastric bypass surgery, digestive inflammation, including Crohn's disease, inflammatory bowel disease, aka IBS, and diverticulitis. Antibiotics if you have overused them, liver disease, cirrhosis, if you have a lower production of stomach acid. This is because acid is needed to absorb minerals such as zinc. If you have heartburn, you're probably deficient in the acid that you need, especially if you're taking an antacid. Phytate or phytic acid would be in foods that are considered to be whole grains because phytate binds with zinc and blocks its absorption. Diabetes and high-carb diets which can deplete zinc, which makes it difficult to get adequate amounts into your system. How do I know if I'm getting enough zinc? Since zinc is a trace mineral, it can be difficult to detect a deficiency through a simple blood test. So a doctor might test blood plasma, perform a urine test, or analyze a strand of your hair to get a more accurate measurement. Symptoms of a deficiency can include unexplained weight loss, wounds that may not heal or take a while to heal, open sores on the skin. This is because zinc plays a role in the production of collagen in the skin. Poor sense of smell and taste, diarrhea, and loss of appetite, to name just a few. It's important to note that pregnant women should be very mindful of their zinc levels because if the mother becomes deficient during pregnancy, that can lead to complications with the child's development. In males, the prostate has the highest concentration of zinc, and a deficiency could lead to lower levels of testosterone and even infertility. Zinc also has a direct effect on insulin levels as it's involved with the production and secretion of insulin. Patients that develop pancreatitis are usually low in zinc, and with this condition, the pancreas is unable to secrete the proper amount of enzymes to break down the food, and also there is a lack of insulin production leading to higher blood sugar levels. It's also been shown that zinc deficiency is linked to depression. Zinc is sometimes considered to be a natural antidepressant due to its ability to bind to dopamine and improve the production of neurotransmitters. This interaction with neurotransmitters also leads to an important role in regulating our sleep-wake cycles through the production of melatonin, GABA, and glutamate. Higher amounts of zinc have been found in people that get 7 to 9 hours of sleep compared to those with 7 or fewer hours. As we can see, many organs and systems in the body are affected by zinc, but the immune system is another big one. Zinc is very important in activating T cells. These T cells attack infected and even cancerous cells, and they help control and regulate the immune response. Zinc has been found to cut down the length and severity of the common cold, in some cases by as much as 40%. It helps to decrease the amount of inflammation in and around the throat where much of the cold virus resides during infection. And last but not least, it's also involved in controlling oxidative stress and regulating inflammatory cytokines. Oxidative stress is responsible for the development of many chronic diseases such as diabetes, cancer, cardiovascular disease, and hypertension, and also neurodegenerative diseases like Alzheimer's and Parkinson's, as well as rheumatoid arthritis and aging. How do I increase my zinc levels? There are two main ways we can get zinc into our bodies: diet and supplements. But long-term treatment for deficiency starts with diet. Some foods that include zinc are red meat, poultry, pumpkin seeds, wheat grain, wild rice, and oysters. If you're a vegetarian, you might consider beans, cashews, peas, and almonds as some alternative sources. But overall, vegetarians might have a more difficult time getting the proper amounts of zinc through their diet. So in some cases, supplementation might be necessary. You can find a number of zinc supplements over the counter at your local grocery or drugstore. But talk to your healthcare provider to see if zinc supplementation is right for you and for a proper dosage that will meet your individual needs. Since zinc plays so many different roles and affects just about every part of the body, there's a lot to talk about. But that's a general overview that hopefully gives you a better idea of this very important micronutrient. If you found this helpful, share it with others and hit that like button as it helps our channel. And subscribe so you can follow along and learn more about staying healthy. Thanks, and we'll see you next time.